Hello, everyone. My name is Tina, and I'm doing this video on Zoom. But my topic is euthanasia and physician-assisted suicide. This is what I'll be discussing in this video, pros and cons. But first, to introduce the term euthanasia, for those who are unfamiliar with this term, I was one of those people. Euthanasia is a practice of ending the life of a patient uh, to limit their pain and suffering. Doctors perform euthanasia when it's requested by people who have terminal illnesses and are experiencing great pain. Another fact about the term euthanasia, it's actually a Greek word that means good death, which is fascinating. To quickly run down the types of euthanasia, which are kind of very similar, like going hand in hand. So there's active, passive, voluntary, involuntary, self-administered, and other administered euthanasia. As I said, they're self-explanatory, some of them, but I will go into detail. But first, to differentiate euthanasia and assisted suicide, some believe they're the same thing, but to go in more detail, as physician-assisted suicide is when a doctor helps a patient who is suffering to die in a painless manner. So a doctor may prescribe opioids and drugs that and then leaves this decision to the individual, and they will self-administer if they choose to. Euthanasia is essentially allows the physician to legally inject the patient with a lethal drug. That is what euthanasia is. So active euthanasia is when when a physician purposefully gives a lethal sedative. So it's when the doctor and the patient are fully aware and are going through this process. Passive euthanasia is when a doctor or physician withholds or is limiting life-sustaining treatment. So the person passes more quickly. And some article actually said that this is similar to palliative care, which I don't understand, because palliative care is when doctor or physician prescribes drugs that basically allow this terminally ill patient to feel less pain or be more comfortable, and informs the patient of the dosages of what may be lethal and what is recommended. And in some cases, actually, an article also mentioned that palliative care is a better alternative than euthanasia. But this is kind of iffy because not all drugs work on certain conditions and circumstances, and it is hard. And these individuals, these patients are still in pain, even if they take the right dosages of the drugs. And in some cases, if they take more and more, they could lead to their overdose. So it's tricky. So to explain voluntary and non-voluntary, which is self-explanatory, but voluntary is when an individual makes the conclusive decision to seek help with ending their life. The person must give full consent and demonstrate their understanding that what will happen. So this is like law. The patient must be fully aware of the situation and fully consent to euthanasia. And many people look into it. Many physicians have to inform the patient of their condition and must confirm that this is the decision that they want to go through with. A non-voluntary euthanasia is similar to passive euthanasia. This is generally when an individual is unconscious or incapacitated. And this is the case when a family member, an emergency contact, makes a decision and allows the patient to pass. And this is when, yes, when you essentially pull the plug and withhold treatment that may prolong the individual's life, if it, yeah, that's essentially what that is. The legality and eligibility for PSA, PAS, I mean, PSA. So in America, in the States, there's, I believe, almost 10 states that have allowed PAS. And in the States, you have to be 18 years or older. Um, you have to be mentally competent, i.e., capable of communicating your healthcare decisions fully and understandably. You have to be diagnosed with a terminal illness that will, within reasonable medical judgment, lead to death within 6 months. This varies depending on the country, the 6 months, but in the States, it has said it has to be 6 months. And as I said, two physicians must examine you and must conclude that this is the decision you want to go through with. In some European countries, I believe the Netherlands is one of the countries, euthanasia with minors are allowed, and some age restrictions are lifted. This is kind of controversial because in some cases there have been a case that a child has been euthanized, a disabled child has been euthanized, and people question that. But generally, I believe a minor has to have their parental consent around from 12 to, I believe, 15, and then 15 and 16, they don't need parental consent, but their parents must be involved. And then once an individual, a minor, is 18, they can choose to go through with euthanasia or not. So if we go, let's talk about the controversial topic of the Hippocratic Oath. This is very controversial because doctors take this oath and essentially say that they will do no harm. And there's this quote in one of the oaths that they take is, "I will neither give a deadly drug to anybody if asked for it, nor will I make suggestions to this effect." And yeah, critics of euthanasia typically argue that killing is always wrong, and PAS is it violates the obligation to do no harm. And some actually argue against this. Some doctors say that actually the oath does include euthanasia and allows and permits in certain circumstances. There's this one doctor that I quoted that said that some people need help dying. To prolong a death is in some cases is not helpful, and it can be counterproductive. This is the doctor, take it as you will. This is what the doctor said. The person who was interviewed. And many believe, first of all, the oath varies depending on the country, and there's variations. And some believe that it should be updated, and some believe that it should allow euthanasia and allow physician-assisted suicide, because essentially you are helping the patient pass painlessly. And isn't that morally right to peacefully allow the patient painlessly and peacefully allow the patient to transition and pass away? And that also brings to question killing versus dying. It is said that killing is morally wrong, and the doctor must not kill or allow or assist the patient to kill themselves, but somehow letting die and withholding treatments is accepted. But some say that killing versus dying there's no difference, and then some say that there's a clear difference. And yeah, that brings to question if letting die is similar to killing. Doctors allow patients to pass away. Doctors withhold treatments or pull the plug, and how different is that? And that's just another question to think about. So the pros of euthanasia. The main is, obviously, the main pro is that it's painless death, and it's relief of suffering, and many people who go through with this do not want to suffer, do not want to feel pain, and some of them are in excruciating pain because their drugs do not work, their medications do not work, and they're in constant pain, and they do not wish to live that life. And who are we to deny them death with dignity? Another pro that was mentioned is closure with loved ones and shortening of grief. This might be a plus for some individuals that allow closure and allows the patient and terminally ill patient to have peace of mind, as well as their loved ones, that the last thing they see is the loved one happy and healthy, and making this decision consciously, instead of all the scenarios with all the circumstances and diseases that might befall the individual. Death with dignity allows individuals to take control of their life and how they are remembered by their loved ones. And that is the main point for many individuals. One thing I also wanted to say is about resources. One article discussed that, is it right to use and utilize resources for individuals who do not wish to continue and do not wish to live? And that's an interesting thing to think about, and brings to question that should resources be utilized for an unwilling patient who does not wish to live and does not want to die? Who's to say? Respect for patients' autonomy. So autonomy refers to governance over one's own actions, and patients accustomed to making their own healthcare decisions throughout life should also be permitted to control the circumstances of their death. So this clearly says that if one can make their decision, healthcare decision of any sorts, how can we say that they're not allowed to choose however they die? Why must they need permission, or what circumstance are we in to request permission of something? Isn't one's life their own, and shouldn't they do with what they want? So it's about autonomy and respect of autonomy in the individual's wishes, and this is one of the pros, I guess. But let's go into the cons. So one of the main cons that are quite difficult to kind of prove is determining or defining competence of the individual who wants to go through with euthanasia. And it's not that straightforward, because how can you determine if someone's sound of mind when they want to die and they want to commit suicide? And that is the main requirement, to be competent and sound, to be able to go through with this process. And could we say that, yes, this person is sound, but also are they because they wish to die? So that brings the question, and how different are they from a regular suicidal person? And a person with depression is more likely to ask for euthanasia, and there are percentages of people who have terminal diseases to be depressed. So that is one of the cons of euthanasia and arguments against euthanasia. There's also like guilt in the being a burden, and guilt being one of the reasons for this decision. This varies in my opinion, but this could be a factor as well. Some say that doctors may be corrupt or unwilling. This is also pertaining back to the Hippocratic Oath. And there was this website that I went to and visited, and they discussed in what scenarios, like statements of doctors might say, and what this might mean if there's doctors willing or unwilling. And corrupt doctors, first of all, they're extreme. They go through a huge procedure as well. They have to fill out tons and tons of paperwork, and other people as well reviews. Two physicians must review, as I said, two physicians must review the individual, and then once the paperwork is complete and the euthanasia is complete, um, the doctors are also examined and evaluated, and there's a committee that reviews the case to make sure that everything was done properly. So the argument of corrupt doctors, I don't know. But there is an argument that euthanasia will weaken society's respect for sanctity of life. This is also a con and an interesting argument. Yeah, will this affect how we think about life and value life? And denying euthanasia honors the sanctity of life and the equal underive more intrinsic moral worth of all persons, including the very weakest, whom can no longer contribute to society. Principles of which so many laws provide. So this is a quote that I didn't read properly. Essentially, this quote was more pertaining to those individuals who are unable to or are unprotected in these scenarios, and some of these cases more pertaining to children and minors. And yes, in one European country, some children and some disabled babies are euthanized, and essentially asking the question of when do we stop, and questioning, like, will there be a line drawn? The line is erasing. And that's what they're basically getting at, and saying that if we permit this, then we might permit something more and more and more. And that's the argument and the question, as is this right, and will it grow? Essentially, will it allow more people to be euthanized, and other variations? And to finally conclude on ethics, who are we to tell an individual if they should or shouldn't die dignified? And personally, I believe that this death with dignity and the laws for death with dignity are right, and there should be an option for individuals who wish to die dignified. But there is also the slippery slope, and the risk of physician-assisted suicide will start with those who are terminally ill and wish to die because of incurable suffering. But this then begins to include other individuals. And yeah, who's to say? Maybe other individuals will be included, but I don't know. I don't think so. I'm not certain. But to conclude on the quote that was in the book that we also discussed in class, morality is, and the very least, the effort to guide one's conduct by reason. That is to do what there are the best reasons for doing, while giving equal weight to the interests of each individual affected by one's decision. I did not read this properly. But yeah, who's to say? And to conclude morality and reasons and conclusions of one sound individual's decisions of living or dying, who are we to say who's right or wrong here? And this is where I would conclude this video.